Hello, my name is Anne Winfrey. I'm a student at Brandman University. I'll be presenting my DNP professional growth plan. I'm going to start by introducing the topic. All right, so my overview. I'm going to be talking about my personal mission, vision, the advancement I plan to do to increase my expertise and credentialing. I'm going to talk about the workshops and conferences that I plan to attend, the research policy and publication engagements that I plan to get involved with. I'm going to talk about having a balanced life. I'm going to talk about the resources that I have currently and my references, of course. So for my mission statement, providing an evidence-based, cost-effective, and compassionate care to underserved patients across the lifespan with psychiatric and mental health problems, ensuring optimum functionality and excellent patient outcomes through the provision of combination therapy, education of both patient and families in collaboration with a multidisciplinary team. And for my vision, my personal mission is to create an environment where the underserved psychiatric and mentally ill patient population are able to function optimally in society and enjoy a good quality of life through the use of a cost-effective, compassionate, and evidence-based care. So we have the federal, state, and local regulation requirements for nurse practitioners, and I plan to abide by those rules. So we have the State Nurse Practice Act for California, and that basically gives us a brief rundown of a scope of practice. There's a California Board of Nursing requirements that we have to abide with as well. So for the organization that I may be working with, they have their own standardized practice and protocols, which I plan to make sure I follow through with. And for expertise, I'm already enrolled in the FNP program at Brandman University. I'm hoping that it will help me better serve my patients. I'm also thinking about getting the teaching credentialing so that I'll be able to teach other students and help mentor the students. And I plan to seek an administrative and managerial position when I'm done with the DNP program. For workshops and conferences, the Neuroscience Education Institute is a very good resource for workshops and conferences. They have especially the one on psychopharmacology. I've been told is very helpful. I'm hoping to attend one by next year. So there's also the American Psychiatric Nurses Association, this Psychiatry and Behavioral Health Learning Network. Here it's not just nurses. We also have psychiatrists, and it's a good networking environment as well. So there's also the American Association of Nurse Practitioners and the Nurse Practitioners Central. Here they have classes that help with improving practice, job opportunities. They have CEUs that are available as well. And for policy research and publication, so advocacy is one of the essentials of the DNP program, and we can do this through policy and legislative involvement, which I plan to do. I already started doing some engagement in advocacy through our local legislature, and also I plan to do this nationally when I finally get my DNP certification. Okay, and there's also a project implementation. So I'm working on the project I'm working on for my DNP, for my clinical scholarly project, is one I plan to implement, and I plan to implement other research work that has been critically appraised and have been noted worthy of implementation. I plan to do those as well, and I plan to look for funding for any research of interest, and going to publication of those researches, and then do presentations in any of the conferences. Okay, so to be able to do this, we need to have a balanced life. I plan to maintain a healthy lifestyle, so have enough sleep, healthy eating, exercising. I plan to spend a lot of time with my family, especially going on vacations, because we haven't been able to do that for a while. I also plan to join medical missions. I already have friends who go to Africa every year. I plan to join those. I'd also plan to join another group that goes to Mexico every year. Volunteering is something that I haven't been able to do in a while. So at least I'll finally be able to do that again, especially in my children's school, and then volunteering at church. Learning a new skill is something I really would want to do again. I'd like to brush up on my swimming, and I'd like to learn how to skate. It's something that I've never learned. I've never bothered to learn, but I think it's time for me to try something new. And for my current resources, the Neuroscience Education Institute is a very good resource. We have an app that helps with prescription. The STARS Essential Psychopharmacology is another very good resource that I use. The Doctor of Nursing Practice Essential by Zaccagnini is another book that is really very helpful. For me, there are very many online resources that that are available to be used out there, especially the social media, things like Facebook and LinkedIn and Doximity. Those are very helpful as well. My mentors are very special to me. They have helped me through this program. And I plan to keep working with them, especially as a novice in this field right now. And then, of course, my professional colleagues, they have been very helpful, and I'll continue to go to them whenever I need help. Thank you very much.